And welcome. We are all here today to alert Arizonans about House Bill 2380, a bill that applies bad healthcare policy to fix a part of our healthcare system that is not broken, and which, if it becomes law, will present a hazard to both individual and community health in Arizona. My name is Brian Rose, MD. I'm a practicing ophthalmologist for over 21 years in the state, and I'm currently serving as the president of the Arizona Ophthalmological Society, representing ophthalmologists throughout the state. Ophthalmologists are MD or DO physicians and surgeons who have received 8 or more years of extensive training in the treatment of eye disease. The Arizona Ophthalmological Society has several missions: continuing education for our members, community service through the Arizona Medical Eye Unit, and advocacy for patient safety and protection, which is why we are here today. House Bill 2380 would permit optometrists, who are non-physician eye care providers, to prescribe powerful and dangerous drugs taken by mouth, therefore affecting all tissues of the body through the bloodstream, to patients as young as 6 without physician supervision. Our commitment to patient safety obligates us to oppose House Bill 2380. Along the way, we have been fortunate to find allies in the legislature that share our concern. I am honored to share the podium with several of the strongest advocates for patient protection in the Arizona legislature: Representative Heather Carter, Representative Ethan Orr, Representative Kate Brophy-McGee, and Senator Kelly Ward. And they will all be speaking to you this morning. Also speaking will be Dr. Dan Bryceland, who's also an ophthalmologist in practice for 20 years in Arizona and a member of the board of directors of the Arizona Ophthalmological Society, and pediatrician Sarah Bodie, forgive me, who will speak about the dangers to children with the bill. The order of presentation will be Representative Heather Carter, then Senator Kelly Ward, then Dr. Bryceland, then Representative Orr, Dr. Bodie, Dr. Charles Schaefer, and Representative Brophy-McGee. Thank you.
Good morning. So I thought I'd start out my remarks today with, what's the difference between an optometrist and an ophthalmologist? And I don't mean that as a riddle, I mean that as a legitimate question. And the simple answer is a medical degree. And oftentimes, when we come down to the legislature, as citizens of the state of Arizona elected to do our job at the Capitol, we're not well versed in all of the healthcare policies and procedures across the state. So we have to rely on the experts in their particular medical professional opinion to make good decisions. What I've come to learn as the House Health Chair, that an optometrist isn't an ophthalmologist light. They are two distinct and important practices, and one should not be confused for the other. Throughout Arizona, optometrists and ophthalmologists regularly work together. It is a collaborative practice where they provide top quality care to the patients and the citizens of Arizona. But unfortunately, with this bill, that is not the case. Actually, what we need to be focusing on right now in Arizona is how to further that collaborative relationship, and this bill actually deletes the language from statute that builds that network of healthcare that is best for the patients of Arizona. House Bill 2380 allows optometrists to treat children up to 6 or over the age of 6 and treat them with oral steroids, carbonic anhydrase inhibitors, and anti-infective and class 2 scheduled drugs. The citizens of Arizona expect us as elected officials to come down to the Capitol and make sound public policy decisions for healthcare. Yet there are really only 2 doctors elected to the legislature, and we have one here with us today. And both of them vehemently oppose this bill. That should send a loud message. Now, technically, I'm a doctor. I have a doctorate in educational leadership. I've also spent a year and a half out in the field as a pharmaceutical sales rep. And I am telling you, based upon my limited experience, that I believe that this bill is bad for Arizona. What we are asking the legislature to do is to make a decision for what is the best for the patients in Arizona. And we need to consider several things when we're trying to decide how to vote. Number one, we have to take into consideration patient safety. we also need to look at what is the problem we're trying to solve with this bill, and how will the policy be implemented. Well, this legislation fails on all three accounts. I can give you a lot of details related to the failure of this bill to address those three issues, but I have a qualified people behind me who are going to share specific information related to the medical problems to the bill. But what I want to talk to you about is the problem that I keep hearing that they're trying to solve with this bill. And that problem is that we have a rural access problem to quality eye care practitioners in rural Arizona. Well, in doing my research, that is also one of the most common reasons we see for expansion of scope of practice for optometrists across the country. But in Arizona, we are actually extremely fortunate to have a robust mobile clinic system and other means of delivering this care. And we should be looking at innovative ways to continue to deliver that care by an ophthalmologist. Simply giving optometrists 3 additional classes of medication does not solve our rural healthcare problems. And it actually potentially puts patients in danger because of the way the bill is written. The expansion includes powerful drugs that even ophthalmologists say they rarely prescribe. And if and when they do, it's typically for the most severe cases, at the very time they should be seeing the ophthalmologist. This bill strikes out of statute that requirement, though, to consult with an optometrist, with an optometrist to consult with an ophthalmologist when those severe cases present. That's a major problem. The majority of the testimony offered has been from optometrists and ophthalmologists, but patients have not asked for this bill. Only the optometrists have asked for this bill. When the medical doctors were given ample time to testify in the House Health Committee, this bill failed on a vote of 1 in support and 7 opposed. When the medical community was only given a limited time to testify over in the Senate, the bill only passed by a narrow margin. During the most recent committee in the Senate, medical doctors, 2 of them, were given 2 minutes each to talk about the medical concerns with this bill. That alone is not enough time to make a good, valid public policy decision. The doctors will have more opportunity at this press conference to speak to our constituents and the citizens of Arizona than they even had in public testimony in the Senate. We've also heard that other states allow optometrists to prescribe these medications, and that the VA allows optometrists an expanded scope of practice. And we often hear there haven't been large numbers of problems. But I'm happy to talk with the press and the citizens after the press conference about the problems in the Palo Alto VA Center. Basically, what happened there is optometrists treated glaucoma in isolation of an ophthalmologist. And remember, the ophthalmologist is the medical doctor. And I have specific information to share with you that out of the 300 and some odd cases that were reviewed, there were actually 22 of those patients experienced progressive visual loss, and 89 were found at risk for visual loss. It was such a concern that they moved the optometrist back under the ophthalmologist at that VA. And it's not as if optometrists can't already prescribe medications. They can already treat many conditions with topical medications and some oral pharmaceuticals. But the oral pharmaceuticals that they're asking for in this bill are a step too far without any statutory language to ensure that if something goes wrong, that the optometrist will refer to an ophthalmologist. Ultimately, this is a very poorly written bill, rushed through the legislative session using questionable legislative methods, and now waiting for final actions in the final hours of the session. There's no pressing need for this legislation at this time, and it's too risky for the patients to take a chance to get the language wrong. Overall, this policy creates a real public safety concern and doesn't solve the problems we have in rural Arizona. And it moves the state away from an integrated model of healthcare that we've been working so hard to achieve. So with that, I'd like to invite up Senator Kelly Ward.
Thank you, Representative Carter. Well, that was very clear, very concise, and very moving and powerful. My name is Kelly Ward. I am a family physician with a master's in public health. I'm an osteopathic family physician, so I have a DO after my name, but most importantly right now I'm serving in the state Senate. And one of the reasons I was elected was to help people down here understand the complicated medical issues that come before us. As Representative Carter said, most of the people down here don't have a medical background, don't have that expertise available to them. And so for me, that's something that I hope to provide, and that's what I want my fellow members and I want the public to understand about this particular bill, 2380. And I love optometrists. I will tell you, I love optometrists. I've got many of them in my district who are wonderful healthcare providers. Ophthalmologists as well. They take care of more complicated problems. Sometimes when you hear, we need to let people practice to the top of their training or to the top of their licensure, that's actually kind of code for let's let people who aren't really where they should be give health care to our citizens, because we need to have access to health care and to health care providers. I think it's a very tricky situation because people shouldn't have to settle for one type of provider versus another, or be expected to be satisfied with you get what you get and you don't throw a fit. People should be able to get the health care they want and that they need, and not be shuttled into something that might not be as appropriate for their particular kind of health. Now, I did speak about this on the Senate floor, and one of my colleagues stood up and said, I said that basically as a physician, I'm expected to know the whole alphabet. I'm not saying that physicians know the whole alphabet, A through Z, regarding every medical condition, but we're expected to. People who train in the middle, who are mid-level providers, they usually are expected to know A through E, A through F, and some may even get close to the end of the alphabet. The problem comes when people who don't know what they don't know. And sometimes that's offensive to people because they think they know. But I don't worry about those very, very good optometrists who will refer when appropriate, who will refer when people aren't improving. The people that I worry about are the people who don't know what they don't know, who may be practicing at a lower level. Right now what we have in statute is a rule, basically, that an optometrist can treat a patient, but if they don't improve, they need to be referred by that optometrist to an ophthalmologist. This bill seeks to remove that. I think that that's a very dangerous precedent. I think we need to keep that in statute. Prescribing some of the medications that they want to prescribe orally are also dangerous. Optometrists focus completely on the eye, and they also do that in a classroom setting. They study for 4 years in a classroom setting, but there's no clinical experience. Physicians go to college for 4 years, go to medical school for 4 years for their academic experience, and then they have 4 to 5 years of residency training where they are under the wing of an expert physician, in this case an expert ophthalmologist, and more than half of the ophthalmologists go on for 1 to 2 more years of fellowship training. So they are clearly experts in the whole body and the eye. So some of the medications that we have, this bill attempts to give optometrists the ability to prescribe, can be dangerous because they act on the whole body, not just the eye. So I would urge my fellow legislators, I would urge the public to get in touch with their elected representatives and let them know that this bill does not protect the public. It doesn't do what you might think it does, and ultimately we should vote no on this and continue to work for the health and safety of the Arizona population. Thanks. Next you're going to hear from Dr. Dan Braceland, one of our ophthalmologists.
Thank you for the opportunity to speak on behalf of the medical community here in Arizona. Here I represent, as I stand here, I represent both the osteopathic and medical community and the thousands of doctors in Arizona who feel very passionate about this issue. This issue really is all about patient safety. It's all about the patient. When you've heard a nice summary of some of the things that are in this bill, but I want to point out that these conditions, these are really the top 1% of conditions. This is why we have some specialists. This is why, as Dr. Ward just pointed out, that there's these extra levels, these extra years of education. There's a bar that's set in the medical community, and that's set by all those years. It's been set for 100 years. It's set by board certification. It's set by examination. It's really, and it does put, I understand it puts the legislature in a difficult position because it's asking them to judge this education. But what I'm saying on behalf of the physicians, osteopathic and medical of Arizona, that this is not acceptable. These patients deserve the best care, and the best care is going to be given by the osteopathic and medical physicians. You heard about their background. I've been practicing here for over 22 years. I have a geriatric community. I can tell you myself, I rarely use these drugs. For example, I had a patient not more than a few weeks ago, an elderly patient with arthritis, hands bent out, had melting of her eye. I sent her to a subspecialist myself. Sure enough, he puts this patient on steroids. The patient ends up with congestive heart failure and in the hospital 3 days later. It's the type of thing that can happen. These drugs have significant side effects: diabetes, hypertension, congestive heart failure. If you just heard, you're going to hear later about some of the very significant effects on children, which is really most concerning about this bill. So on behalf of the physicians, both osteopathic and medical, I ask you to look more seriously at this bill and vote no on House Bill 2380. Thank you for your time. I'm going to have Representative Ethan Orr give a few words.
Thank you. I appreciate that. You know, most of the people here have talked about the outcome of this bill, and there are a lot of problematic and frankly dangerous aspects of this bill. Anytime you expand the scope of work, that's a possibility. One thing I want to talk about, however, isn't just the outcome of this bill, but the process by which this bill was originated. The process is there to protect consumers, it's there to protect patients. The reason we have stakeholders groups, the reason that we have committees of referral, the reason we have oversight committees served and staffed by medical professionals is that people with years of training, they're the ones that should be deciding whether or not this drug is safe to be prescribed by someone without a medical degree, or this scope of practice is safe to be expanded or retracted. And any time you expand a scope of service dealing with the medical community, you have to have those experts at the table. You have to vet that bill. You have to go through the appropriate process. Because as the doctor said, you should not take 60 and 30, frankly, uneducated people, because there's so many other things, throw a bill dealing with people's lives and people's livelihoods and expect them to make the right choice without properly vetting and taking that bill through the process. So my qualms with this bill lie not just with the outcome, but with the process that brought us here. And I think anytime you expand the scope of service, you have to look at that process, which is there to protect our consumers and there to protect our patients. With that, I'd like to introduce Dr. Sarah Bodie to talk more about some of the dangerous outcomes that are a result or a potential result of passing this bill.
Good morning. My name is Dr. Sarah Bodie. I'm a pediatrician practicing in the Valley. I'm here today on behalf of the Arizona chapter of the Academy of Pediatrics. As a group of pediatricians, thousands of us practicing in the Valley, we are also very concerned about this bill. We say this a lot, but 6 and up, that makes no difference to us. If you're a 6-year-old, that doesn't mean that you're a small adult. And what that means is that your eye conditions are different than adult conditions, and the medications you use and the effects of those medications are different as well. So we're very concerned about this because some of the oral medications that could now be prescribed under this bill, oral steroids, the carbonic anhydrase inhibitors, those are very dangerous medications to kids. They have serious side effects and really need to be used in severe cases and under the instruction of a physician. For example, carbonic anhydrase inhibitors in kids can sometimes cause aplastic anemia, which means all of a sudden that child's no longer going to be making blood cells. It could lead to serious injury, hospitalization, and even death if that was not identified. Oral steroids in kids are a very problematic thing if they're not used in the right way and under the supervision of a physician. They can cause growth problems, diabetes, a host of other problems in kids that you may not see in adults. Kids get sick quick, and when we use medications, we have to be careful. And I'm very concerned about the scope of this bill and what that could mean for our youngest children if they're not able to access appropriate care, particularly if someone is not specifically trained, not only in the eye, but also in care of the pediatric eye, which again is a little bit different. Even ophthalmologists do extra training in pediatric ophthalmology in order to understand how these medications can affect kids. So again, on behalf of the Arizona chapter of the Academy of Pediatrics, we would urge you to vote no on this bill.
Good morning. My name is Dr. Charles Schaefer. I'm a board-certified ophthalmologist here in the Phoenix suburban area, and my perspective kind of dovetails with what some of the other doctors and representatives have said here this morning. In particular, my background differs a bit from the others in that, yes, I'm an MD and board certified in ophthalmology, but with regard to practicing in a rural area, I've had experience of doing that as well as a commissioned officer in the United States Public Health Service for 3 years, 1990 to 1993. in quite a small community in the Four Corners area of New Mexico, and I well know the spectrum of pathology that can present even in small towns, and how important it is to provide people really the best care no matter what kind of environment they're presenting from. With that, despite the fact we're in a rural community, we still had access via telephone or other electronic means to consult with my colleagues when I'm using medicines in practice that I deem that are above my level of daily practice and use because of the potential for their side effects, including aplastic anemia, which has been mentioned, and fractured hip, bleeding ulcers. The second part of this, which I can shed a little bit of light, is I'm also fully trained in internal medicine, having done a 3-year residency program in that. During that time, we see the sickest of people managing the intensive care units and the like. And despite the fact that I'm fully trained and finished an accredited residency in internal medicine as well as in ophthalmology for a total of 6 years of training, it is precisely because of my experience with those drugs that I won't prescribe them unless it's done in concert with someone who practices on a daily basis, either internal medicine or rheumatology, in the case of steroids. It's not as simple as putting a prednisone tablet in somebody's mouth. As Dr. Bryceland mentioned, there are the ramifications of congestive heart failure or reactivating tuberculosis. And when agents like this are used, they have to be looked at from the perspective of those eyeballs being connected to the rest of the body. One thing that's certain is everyone standing around me and in the audience here likely has access to superb medical care. Well, there's 6 million others of us in the state of Arizona who are entitled to the same level of care as we are, because one day, like many other things in life, medical care will be something that we all need, and there should not be discrimination between the level of quality that some can receive and others can't. And I think that level of quality should be based on one's training